I'm Miguel Almaguer. Tonight, as our nation grapples over how and when to reopen the country, this warning from the director of the CDC: a second wave of the coronavirus outbreak in the fall could be even more difficult than the current national epidemic because it would come at the opening of flu season. Today, the president calling the interview into question, saying the CDC director was misquoted. But many experts believe the virus will surge again.
The issue that I was talking about being more difficult, is that we're going to have two viruses circulating at the same time.
With concern mounting over what will come next, doctors in Santa Clara, California, now confirm the first documented COVID-19 deaths in our country. The first two fatalities now linked to the Bay Area, February 6th and 17th. Weeks earlier than the deadly outbreak at nursing homes in Washington state. The victims had not traveled to China, suggesting community spread well before the first case was recorded by the CDC.
The virus was probably introduced and circulating in our community again far earlier than we had known.
Declaring the virus was perhaps present as early as December, officials now say it may have been a stroke of luck. The San Francisco 49ers didn't win the Super Bowl. If they had, a Bay Area parade like this one in Oakland in 2018 could have fueled the spread.
Here in Los Angeles County, where coronavirus cases could become the leading cause of death, hospitalization and ICU cases are still rising, even as parts of the state reopen for business.
This is the sound of freedom.
With protests across our nation again today, the director of the CDC says the demonstrations are not helpful. Katie Beck is in Richmond.
In Virginia, hundreds of protesters causing gridlock at the Capitol, urging the governor to lift his stay-at-home order so Virginians can get back to work.
Tonight, the calls to reopen the country and the warning the virus may return with a vengeance. Miguel Almaguer, NBC News, Los Angeles.
And not to be ignored, some of the important voices in this debate over reopening, doctors and nurses sounding the alarm with some ERs still pushed to the limits. We should warn you, some of the images you're about to see are disturbing. NBC's Gabe Gutierrez has our report tonight on the front lines.
Everybody move. At St. Joseph's Hospital in Yonkers, New York.
We do this all day, every day for the last month.
The war has not let up. The Associated Press was granted access to the overwhelmed ER.
It's been a nightmare. We have a volume of sick people like you can't believe. In one shift, I pronounced 6 people dead.
Yes, move, everybody move.
This is the frantic, ongoing battle to keep patients alive, even as parts of the country push to reopen.
We can't be overconfident until we have some measure of being able to say it's in the past.
Despite the gratitude pouring in, the toll is exhausting, and it's not just physical.
It's hard not to take your work home with you. I sit at home reliving each death, each delay in my head. The statistics tell me that this person's father probably wouldn't have made it no matter what I did. But my heart can't help it.
Dr. Rishi Ratan is a trauma surgeon who works in an ICU in Miami.
Maybe if I put my PPE on faster, maybe if I started another medication instead of the one I did. Maybe if I stayed up one more hour researching the next best treatment for coronavirus, maybe he would have made it. Maybe if I had been better, I wouldn't be standing outside telling a sobbing family that we've lost their loved one. It's hard not to take every death personally as a sign of your failure.
Failure is not what's happening here. Far from it. In so many hospitals, triumph.
I've never been so sick, feeling like you're going to die, wanting to die because you feel so bad.
Megan Harple is a nurse in Louisville, Kentucky, who was desperately sick with coronavirus for 3 weeks.
It really literally felt like my back was breaking in half, like somebody was hitting it with a hammer. My bones hurt, like I couldn't walk, I couldn't do anything.
She has this message for protesters.
If we open up too quickly, too soon, too fast, everyone's either going to be in the hospital, in bed for a month like me, or dead.
Here in New York, the number of coronavirus cases appears to be declining, but more than 400 New Yorkers are still dying every day.
Yeah, we shudder when we hear those kinds of numbers. All right, Gabe, thank you. And tonight, an extraordinary allegation from the doctor who led the federal agency involved in developing a coronavirus vaccine and is now out of that job. Jeff Bennett at the White House now. Jeff, what do we know?
Lester, Dr. Rick Bright says he was removed from his post after he pressed for a thorough vetting of a coronavirus treatment embraced by President Trump, specifically the drug hydroxychloroquine. Dr. Bright says in a statement obtained by NBC News, "I believe this transfer was in response to my insistence that the government invest the billions of dollars allocated by Congress to address the COVID-19 pandemic into safe and scientifically vetted solutions, and not in drugs, vaccines, and other technologies that lack scientific merit. I'm speaking out because to combat this deadly virus, science, not politics or cronyism, has to lead the way." President Trump spent weeks hyping hydroxychloroquine as a potential coronavirus miracle drug, but a new study of coronavirus patients in VA hospitals found more deaths among those treated with the drug than those treated with standard care. The Department of Health and Human Services did not respond to our request for comment. Lester?
All right, Jeff, thank you. Also breaking tonight, the first known pets to become infected in this country. 2 cats testing positive for the virus. Kristen Dahlgren tonight on what you need to know.
Tonight, the CDC and Department of Agriculture confirming infection in 2 pet cats living in separate areas of New York State. The first pets confirmed to have the novel coronavirus in the U.S. Both cats had minor respiratory illness and are expected to make a full recovery. In the first case, no one in the house had tested positive for COVID-19, while in the second, the cat's owner tested positive first. Experts now believe animals can get the virus from humans, but say there is little risk of humans getting COVID-19 from their pets.
Your biggest concern is definitely people more than pets. And if your pet does have it, you probably gave it to them.
And news late today that 8 lions and tigers at the Bronx Zoo have now tested positive for coronavirus. Earlier this year, a dog infected with the virus died in Hong Kong.
So a lot of people now wondering, how can you tell if your pet is sick and what can you do to keep them safe?
Symptoms in pets are similar to humans, including a cough and runny nose. For now, the CDC says pets should social distance, just like us. Don't let pets interact with people or animals outside the household. Keep cats indoors when possible. Walk dogs on a leash and avoid dog parks or public places. And stay away from them as much as possible if you're sick.
If you do have symptoms of coronavirus, then wear a mask and make sure there's a lot of hand cleaning going on.
Bottom line, treat your pet like any member of your family to keep them safe. Kristen Dahlgren, NBC News, New York.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.